Hello and welcome once again to Moorgate Andrology. Now in today's video I want to talk about a subject which guys bring up quite often, and that is what is the biggest penis enlargement surgery? What is the maximum that you can do to increase the size of your penis? What's the biggest results possible? What are they? So there are two aspects to penis enlargement surgery, as you know. The first is to increase the length of your penis, and the second part of the procedure is to increase the thickness of your penis. So let's deal with those two parts together so we can see what is actually possible. In the first aspect, the lengthening procedure, we lengthen the penis by dividing a ligament called a suspensory ligament, which is hidden deep underneath the pubic bone. And when this ligament is divided, it slides the penis forward and reveals this hidden length that all men have to some extent. The results of this maneuver are quite predictable. We know that when we divide the suspensory ligament, this will increase the flaccid length of the penis between 1 and 2 inches. 95% of men will get an extra 1 to 2 inches in the flaccid length. 5% of men get either a little bit less than 1 or a bit more than 2. But for most, it's between 1 to 2 inches more. Now, 6 weeks after the surgery, you're given a traction device called a Phallosan Forte, which over the course of the following 12 months stimulates growth factors within the penis to increase erect length. And it's possible to increase the erect length by up to 1 inch after the surgery. So results from lengthening surgery are quite predictable. We know what is possible. And once you've had the lengthening surgery done, because we place that device called a silicone buffer in the space that's created when we divide the ligament, the results of the lengthening are permanent. But perhaps when we talk about biggest penis enlargement surgery, most guys are talking about the girth, because they want maximum girth, the biggest girth possible in many cases. And this is possible with a fat transfer procedure. So at the same time as the lengthening surgery, we can transfer some fat, usually from your stomach or your inner thighs, and inject this into the penis to increase its girth. And this will increase your penis girth when it's flaccid and when it's erect. Now, in most cases, guys will have just one procedure. They have the penis lengthened and thickened together, and that's the end of it. But for some men, they want more. They want much more in terms of girth. And what happens is they come back no less than 3 months later, but generally between 3 and 12 months later, they'll come back and have another fat transfer procedure to increase the penis girth even more. Because the girth increase is visible when the penis is flaccid and also when it's erect. So if you want the biggest penis enlargement surgery, then you need to have a package where first you get the length and girth done, and then secondly you come back and have a fat transfer top-up surgery. If you want to know more about penis enlargement surgery and how to get the biggest increase in your penis size, then you can find out more at www.moorgateandrology.co.uk. Get in touch with us if you have any questions about penis enlargement. We're more than happy to help. That's all from me today. I hope that's given you some insight into how to get the maximum results from penis enlargement surgery. Until the next time, bye for now.